On behalf of the FAS diversity team, I'd like to welcome you to this diversity dialogue, our first one for fiscal year 2020. That's right. We've been engaging in these conversations for 10 years now, and we thought it was time to make some changes, so we made quite a few this year. First, this is a space change and a setup change. And so we hope you all are comfortable with it and that you'll give us your feedback at the end. We're always trying to identify new ways that we can get your feedback so that we can adjust our programming and plan new programming. And so for the first time, we sent out questions asking you to tell us what you think beforehand. And that was really, really helpful and useful to us. It helped us as we continued to plan. It helped the presenters as they planned their presentations and their conversations that they'll have. And so we appreciate you doing that. You should also know we will still send a survey out at the end. And so please feel free, and please, we encourage you to send the survey back with your comments after today's dialogue. Now, this year's theme is Invisible Dimensions of Social Diversity. And we all benefit when we can share our own background and experiences with others, even when those backgrounds and experiences aren't necessarily visible to the person you're talking to. That adds to the richness of our relationships and our conversations. In August, our summer panel was focused on mental health. We had a tremendous amount of interest, responses, requests for more conversations about mental health. And so today our theme, one of our topics will be mental health, and the other topic is ethnicity. We have two experts in these fields who will discuss with us how these topics are individual and also how they intersect. So are you ready to get started? Yes? Okay. We are so fortunate to have as our moderator today, Renee Graham. We first met Renee last year at our 10-year conference that we held, and she moderated that day for us. Renee is a Boston Globe columnist and editor, and she's known for her astute analysis and her direct prose. You can listen to her on WBUR programming, and her opinion is regularly sought out by major news outlets both locally and nationally. And we're so pleased to have her with us today again, so I'm going to ask Renee if she would come forward.
Thank you so much for being here. I'm honored to be here, and I'm hoping we're going to have a really vigorous and vital conversation about a really important issue. And I want to first just introduce our two experts. Dr. Kristen Lee is an associate teaching professor and lead faculty of behavioral sciences at Northeastern University. And Dr. Tracy Robinson-Wood is a professor of counseling psychology in the Department of Applied Psychology at Northeastern University. So I'm going to kind of just sit here, but generally get out of their way and let them start the program.
I'm going to shut it off. I'll let them pull that up. I just want to say a wholehearted good morning to everyone. And I've gotten to speak with some of you this morning. And so first off, I want to just say thank you to Andrea, to Dominique, my distinguished colleagues, Renee and Tracy, and to all of you for your intentionality as you've prepared for today and you've come in for today. I especially want to say thank you for the feedback that you've provided. You provided a robust amount of feedback so that today we can really dig in. And one of the intentions that we set for today is that the measure of good inquiry or good discussion is that hopefully we'll turn up with more questions than answers. I also want to be mindful that everyone walks in with different lived experiences and different stories. And I believe that, again, one of the deep intentions today is to be thoughtful about how do we navigate resources within this ecosystem here. And so I just want any of the staff to just put your hands up. If anyone today has questions that come about, we have a resource guide, but if further questions come out, it's really important that you know who your go-to people would be. So Andrea, I know that's you included, but we just also want to be mindful of that because we recognize that we have some provocative content to share. Having said that, I want to just start today with some key thoughts, just in brief, to think about our context. So many times with the mental health conversation, we think about ourselves in isolation. And one of the biggest lies that mental health issues can tell us is that we're alone, that it's only us, that if we would just try a little bit harder, this wouldn't be the case for us. And a lot of times we're not thinking about social context and social conditions that are bearing down upon us. And so today, one of the things that we sort of want to embody is this idea about unlearning and really creating space to unlearn some of the things that we're taught about ourselves, whether that's because of social identity category or we're taught about ourselves if we're struggling. And so that's something we want to help deconstruct today. And I want to just sort of provide, again, like, well, what's the context? Everybody always asks us questions. What's happening for all of us? They're actually calling it the age of anxiety. They're saying that 1 in 3 of us are experiencing clinical symptoms of anxiety. And in fact, the World Health Organization has said by 2030 that lifestyle sickness and stress-related illness is going to surpass communicable disease. So it used to be that we were afraid we were going to catch stuff. Now it's the stress and the anxiety. And we even have new words like infobesity. They say we're taking the equivalent of 174 newspapers a day, and they're calling it techno-stress. So many of us are in a position, and I know I was speaking with some of you this morning, who feel like there's pressure, increased pressure to do more with less. And we sort of have these unprecedented opportunities to achieve, while at the same time, this overwhelm, almost like we're expected to operate like we're robots or machines. And we're seeing this in the data overwhelmingly on a global level. In fact, the World Health Organization recently redeclared and reclassified burnout not as a health condition, but as an occupational risk and a workplace condition. So I think it's important for us to reflect on these data points because, and obviously when we think about whether because of racism, classism, heterosexism, ageism, ableism, we think about xenophobia, we think about all of the social contexts that also, in these isms, the oppression and discrimination, that also affect access to care, that also influence a person's ability to feel safe, to disclose what's happening. And those are things, again, we want to really deconstruct today and get into. So this is a quote that I love. So it says that the illiterate of the 21st century will not be those who cannot read and write, but those who cannot learn, unlearn, and relearn. So for me, I get really nerdy about behavior science. I love to think about what we know now about behavior science and what we know now in terms of looking at ourselves from a strengths-based lens and being able to apply those discoveries today. And what I've seen overwhelmingly in my life's work is this notion that we're only looking at half of the piece of things. And so I want to just kind of bring you through a few quick myths of mental health, a few pieces of unlearning that can help us, again, create space to see ourselves and one another in a new light. So here's one that's a classic juxtaposition of old school psychology. So think Freud, think couch, think clipboard, think the whole interview. What's wrong with you? And I remember when I was first starting my clinical training, I had a supervisor who was like of this mindset. And I'd go in and I'd be excited to talk to her about those I was serving in therapy. And I saw these great glimmers of hope and strengths and resources and talents I wanted to build off of. And she was kind of like the classic, what's the matter for you? Like, what's the matter? So she'd be eating her drinking her Dunkin' Donuts with a bagel with a 3-inch thick cream cheese. And she'd be like just talking about like, you know, like she didn't see any strengths in anybody. And I couldn't fathom that. I thought like, how do we only look at all this? And luckily, what's interesting to me is in the 1900s, Bertha Kaplan Reynolds, she was a pioneer in social work. She said, we need to look at strengths, not weaknesses and deficits. So do you think anyone listened to her in the 1900s, a woman? Nope. Guess what happened in the 90s when Martin Seligman, the head of the APA, American Psychological Association, he came out and said, we've only gotten psychology, we've only half-baked it. Because we've baked the part about diagnosis, pathology, disorder, what's wrong, what's the matter for you. but we have not baked in the strengths and the resources and the capabilities. And so this is such the Rorschach scenario. How many of you have seen the Rorschach test? This is kind of a metaphor, right? So back in the 1900s, Herman Rorschach, they didn't have Netflix or Instagram. So what they did is they made sport of ink blotting. So he had this novel idea. He could use this as a tool for diagnosis. And by the way, he looks just like Brad Pitt, if you've ever seen him. All right, but this was his whole thing. He thought, like, okay, so, but who got to decide? If he sees a cat in that picture, who gets to decide that if you see a dog, that you're messed up? And this is the classic example of the dominant group setting the precedent, like to say what they think is normal, what they think is okay. And this whole idea of people are broken goods is a tremendous misstep and a disservice for all of us. Similarly, if we look at resilience research, I'm a resilience researcher, right? When we look at it, especially in the US context, it's very individualistic. It's very pull your bootstraps up, suck it up, bite your lip, don't let them see you sweat. It's very individualized. What we don't talk about are the social conditions that create the need for us to be resilient in the first place, right? So we're not talking enough about the barriers, about the discrimination and oppression according to race, class, gender, sexual orientation, age, ability, size, religious affiliation, country of origin. So we're kind of like, we get very romantic about resilience. How many of you hear about resilience all the time? It's a classic buzzword, right? You can't enter a parenting conversation, a conversation in education, a conversation in entrepreneurship without resilience. Like we really think, oh, we love the setback to the comeback. But we're not talking on a deep enough level about the social context in which we're trying to navigate. And what happens is that creates a stigma for us with lived experiences. The other big thing is that mental health issues are obvious. And this is something that I saw come through in your data that you said. One of you said, we work in an environment with very emotionally intelligent people. So it's not always obvious that people are suffering. And I think one of the things I talk a lot about in my work is using universal precautions. Just like we think about in healthcare, we have to understand that we are all subject. One of the things that's come out in the science is that no longer, think about how we might frame it, like I'm a person with depression, or I'm bipolar, right? These are like the classic old framings. What we're now seeing is it's not a fixed thing, that in fact we are all, as human beings, likely to vacillate in and out of episodes throughout our lifetime. And one way we could put this is human condition, not mental health condition. Think of the words, the vernacular that we use. And then again, it's like we think we have to show up very shiny and polished in our Instagram culture as well. We're sending out our curated versions of ourselves. For me as a first-generation college student, I remember when I came into the academy 10 years ago, I was so intimidated. I felt that I had to really like hold that posture. And then everything changed as I learned from my greatest teachers who are my students. And I want to just share a tiny bit of the research that I've done with them. But I also want to just give a couple more quick ones. This whole notion that mental health issues are shameful. We know that stigma is the #1 impediment to getting help. And this is something, again, when we think from that old school Freudian perspective, that we should feel ashamed, that we don't want to embarrass ourselves and or our family, or we think we're the only ones. And what I also am very concerned about in this context of today, they're actually naming loneliness as the new smoking. How many of you have heard this before? So the sense of isolation, when we look at what contributes to resilience, it's community. Community is where we heal, where we come to unlearn and relearn, and where safety is created within community. And so many times we're isolated and we hide out. And when we look even at the exorbitant rates of suicide, what we see is that a lot of times people aren't getting help until they're in crisis. And what we have to do, in addition to adopting a universal precautions approach, is to think about a lifespan approach, that prevention is less costly than repair. And so today we want to just share a few strategies around what is it that we can do to make sense of this context. How might we protect ourselves? Here's one, self-care. How many of you heard of this buzzword lately, self-care, right? There's a lot of hype, a lot of hashtags on self-care. One thing I want to emphasize is that it's not, how many of you like Parks and Rec with Don Amigo and Tom? So they do treat yourself day, right? So a lot of times people think that's what self-care is, like it's waiting for that next vacation. How many of you, when you get to vacation, you get sick? Raise your hand. if you want. Or you go on the cruise and the ship sinks, or someone throws up on you, or someone breaks their ankle, right? We can't wait until the next big vacation, right? And I hear that all the time as I work with folks. It's like, well, I'll wait until this happens, or when I reach this point, I won't worry anymore. And there's always going to be something coming around the corner in this age of overwhelm. So self-care is a deliberate, intentional process. And what I believe wholeheartedly, I've seen this in my research, in my clinical work, in my own life, that it starts with giving yourself permission to take care of yourself, to recognize you're not a robot. You're a human being, not a human doing. Our brain can only take in so much and handle so much. And so it's wise to engage on a daily basis in self-compassion, quieting that toxic inner critic, rethinking what you've been told about your so-called suffering or your so-called weaknesses, and to really engage in that. And what we see from the research is even just a 20-minute activity like a brisk walk or time in nature. Or how many of you heard of mindfulness, right? Mindfulness is like the new kale, right? There's so much hype about mindfulness, right? Well, why? Because we're in this age where all these global mental health, the mental health crisis is so intensive, but also we have the science behind this 2,600-year-old practice that shows that just that presence, that focused presence in the now, off our screens, breathing, relaxing. We have a stigma about leisure here, right? How many of you, when you have downtime, you call yourself the L word, lazy, right? We have to give ourselves permission. It's not superficial. It's not just feel-good pop psychology stuff. Very, very briefly, I want to share with you. As I've worked with students from around the world at Northeastern, I became really impacted by their resilience. I work with many international students coming here to the US, many first-generation students, and many students of color. And I was tremendously impacted by their resilience, and I got curious about it. So I launched a grounded theory study, and I want to just give you a couple quick key pieces, and then we can talk about it as we go on this morning. But I was really impacted. I was looking at what's contributing to your resilience and your sense of identity. And in short, what it was accepting the dual narratives of one story, of being able to say, it's not about me and my success or climbing the ladder or showing up airbrushed and polished and caring what everybody thought, but it was also about understanding that my lived experiences, any kind of difficulty that I've experienced has served as a catalyst for growth and learning. And it's something to be proud of. So I call this kind of moving from a me mindset to a we mindset. And in academic terms, the construct that emerged was called collective efficacy. And this really builds off of Albert Bandura's work, who says, if you think you can reach a goal, you're more likely to set it and then go on to reach it. Collective efficacy is the idea that an injury to one is an injury to all. So if you hurt, I hurt. And if you're doing well, I'm doing well. So it really focuses more on the greater good and community. And again, that's where healing takes place. And what we know from the science of human flourishing is that when we show up less about hyper-performance and just that whole hitting all the metrics of so-called success, when we show up in a way where it's about purpose, impact, about social change, about being allies, about advocating for ourselves and for everyone around us, that's when we flourish. That's when we thrive. And that's not what's being sold writ large. And one of the key things I saw in my students that they had to overcome was imposter syndrome. How many of you have heard of imposter syndrome? Terrific. So you understand this is, what key words do you think of when you hear it? Fraud. What else? Pretend. Yeah. What else? Not being authentic. Authentic's like the new fake, right? Everyone uses the word authentic. It's like, what does it even mean anymore, right? But it's that whole sense of someone's going to find me out. I didn't deserve my spot. I'm not as smart as they think. It's an intellectual form of self-doubt. And this disproportionately happens for persons of color, first generation students and professionals, for women, for LGBTQA folks, for anybody who's in an othered category, a non-dominant category. And so imposter syndrome is something we have to work to deconstruct. We have to stand up to. We have to recognize that these are isms, these are social conditions, and it's like people call it a syndrome, but it's not. Again, it's the isms. It's really bearing down upon us. And working to recognize that if you are experiencing anxiety, fear, trepidation, et cetera, in this context, that's human. That's human. So, there's a lot of different pieces here, but again, I just wanted to focus on that change. And I also have the key word up here, commodity complex, which is the idea that you're a number, again, you're a robot, you're a machine, you have to perform. By the time, now in this context, by the time a child is about to lose their first tooth, they already need to know which college they're going to. By the time they're in 3rd grade, they need to be 5 grade levels ahead. By the time they're in high school, they need to be taking AP classes. By the time they're in college, they need to have their startup, right? And so this, right? And then by the time you're 25, you're like, oh, right? So but this goes across our lifespan because we have these, you guys are laughing, right? We have these opportunities, but it's almost like, when is it enough? And the research shows us that when we align our values to our behavior, when we're really thinking like Paulo Coelho style, the alchemist, about our personal legend, why we're here, how we can bring impact, how we can forge social change, that's what transforms us. That's what helps to keep us healthy, and that serves as a protective factor. So I want you to reflect on this today. I want you to think about this. Again, this conversation is going to go by very quickly for all of us today, but I want you to think about, how do I deconstruct this within my own life? What are some methods? And again, we're going to really unpack this as we go on today. Couple quick things as I wrap up. So recognize our context as a human risk. Knowing that we're not alone really helps us to start that process of unlearning and relearning. Another thing the research shows us is that we engage in something called supervised skill practice, which is just a fancy way of saying, find your tribe, find your hub, find your squad. Be with people that will hold you accountable, that will encourage you, that you feel safe with. That helps us to say we're going to put some kind of self-care routine into place, or we're trying to overcome imposter syndrome or the toxic inner critic. We need people around us that are going to help us with that. We also want to make sure we're creating both help-seeking and help-giving environments where it's safe to disclose, where it's safe to be ourselves, to be our true authentic selves. Again, I mentioned the universal precautions lens. And the other thing is, when it comes to the Rorschach, like, of course, it's pseudoscience. Of course, since the 1900s, people have said, like, this is not a thing. But guess what? It's still being used. And think of all the methods. If if any of you have ever gone to therapy, sometimes therapists will ask you all the wrong, all the questions. What's wrong, right? And then, like, at the end of the evaluation, maybe there's one question about what's working well. We need to build just as much on our strengths, our resources, our values, as we think about what's wrong, or our anxieties and whatnot. And then finally, just prioritizing self-care. Giving ourselves permission. I feel like that's the number one step, is knowing we all need it. We can all benefit from it. And just those small things can make a big difference in our lives. Aligning our values to behavior and mining for strengths. So just focusing, how do we build on our value set and our strengths to help us to flourish? And then seeking community and finding and being allies. And today I think we also want to talk about intersectionality, right? And how across our different lived experiences, how can we find common ground? And how can we see ourselves and help each other in new ways? Another big thing is just unhooking from notions of perfectionism. Perfect is an illusion. It's a myth. We are all struggling. Every person in this room is affected by mental health issues. Every person. This is just part of our human experience. And, to keep unlearning. And one of the things, so we'll talk a little bit more about this today, ways we can actually implement it. But one thing for me as I close today, this is something I've done so much thinking about after working 20 years in outpatient mental health. I've been at Northeastern for 10 years, and I realized that as I'm in a position of power and privilege, and I've always advocated for no stigma, open dialogue, understanding the science, I realized that the way I was presenting my own story was a little bit polished. So I decided to come out and talk about my own lived experiences with mental health as a person that struggles with depression and anxiety at a public forum with all of my peers, all of my colleagues. And after I did it, so I totally went off script. All kinds of disclosures. I walked out, I had the classic, what have I just done? Am I gonna get fired? Who's gonna be watching me now? And long story short, instead what I got was, I'm so glad you said that. That's exactly how I feel. but I was afraid to say it. Thank you. And it created new community for me. And for me, where's Waldo? This was me when I was in my undergrad years. And I was the classic like hand up in class, president of different organizations, like very, very friendly, social. I didn't look like the classic case of depression. And this, at this time, was a time that I almost lost my life to suicide. And it wasn't until someone asked me something very simple, which felt awkward. One of my professors said, "Are you okay?" And I was like, oh gosh, like how does she know? And then that's how I started to get help. That's when I went to therapy for the first time. And that began a process of healing from the trauma that I had gone through. And since then, I've gone to be my own case study for burnout and anxiety. In the academy, of course, it's intensive, but I think we have to tell the truth of our stories. We have to find ways to, again, find solidarity, to find community, to recognize that we're not pathological and broken if we're struggling. It's part of our human experience. And one thing about mental health is it's preventable, it's treatable. There's always help, and I want you to understand that today and walk away with that. A couple things I've done, just if you want to look to Thrive Global, I have a few things on the information sheet, but just a lot of the different public work I'm doing to really help with this unlearning process. So feel free if those are resources that you can use in your community for yourselves and those you're serving. And then lastly today, I wanted to just provide just some crisis information as well and ways to be in touch. And with that, I thank you so much. I look forward to our dialogue. Thank you.
I'm Tracy. I'm delighted to be here, and I'm delighted to be with Renee and Kristen. Kristen contacted me a while ago, and she says, you know, Harvard has asked me to be involved in this dialogue on diversity, and I wanted to know if you would like to be one of the presenters with me. And I said, yeah, I would like that very much. Kristen and I had been on a panel together or a part of a conversation at Northeastern. I just want to thank you for holding me in thought and remembering me. So I'm delighted to be here. Thank you for making your way here. There are other places that you could be. So my hope is that we can have a chance to really engage in some good dialogue, some difficult dialogue, a place of safety where you feel like you can speak your truth and ask your questions. We live in a world where oftentimes we are scrutinized by people in terms of what is right and how you should behave and comport yourself, and we do that to ourselves. So my hope is that we can listen and, as Kristen said, learn and unlearn and realize that some of the lessons that we have internalized consciously and unconsciously aren't necessarily good for us. So we can become more mindful and conscientious about that. So let me get started. So I wanted to just start with some beautiful words from Andre de Shields. I was listening to a video that he had done, a tape regarding this statement. Surround yourself with people whose eyes light up when they see you. And I say this to my patients. I'm a clinician in New Hampshire, as well as my full-time position at Northeastern as a professor. And this is so important to the brain, because our brains know when we're in spaces where people are pleased as heck to see us, right? And we know when people are pleased that we have arrived, that they've been waiting for us, that they hold a banner that says, "You're here? I'm glad you're here. I'm glad that you've come." Because there are also spaces where we inhabit, where we don't see that light in people's eyes, right? And we know that, and we coexist with that. And that can be depressing, anxiety-producing. So what is my goal for today? Hopefully that we can enlarge our toolkits, which means I say to my patients, what's in your toolkit to navigate this terrain? What's there that can help you to move through this more quickly, with greater agility, with more confidence, with more competence? So we can build our toolkits, right? As it relates to microaggressions and other invalidating environments, that's a term that I received from Marsha Linehan. She has done some work with patients who have a diagnosis of borderline personality disorder. Some of my patients do, but it's not just for people with borderline personality disorder. It's for people who are dealing with mental health issues, with challenges, with stress overload, invalidating environments, and we'll talk about the definition of that, but that's what microaggressions are, to encourage dialogue, but also to exhale, take a deep breath and gather strength, right? So Chet Pierce, who was one of my professors many, many years ago when I was a student here at Harvard, brief and commonplace daily verbal, behavioral, or environmental indignities, whether intentional or unintentional, that communicate hostile, derogatory, or negative racist slights and insults toward people of color. I've done some research with my research team, and certainly we focused on people of color, but we've also focused on people who identify as LGBT, and people who are ethnic minorities, and they are not necessarily visibly read as other, and so that can in of itself be part of a depressing and unvalidating environment. So it's a large group of people that our research has looked at with respect to these environments that can be very invalidating. So you don't have to be a person of color to inhabit a space as a woman, as a person who's large-bodied, as a person whose first language is not English, as a person who's someone who was exposed to trauma as a child. Those adverse childhood experiences can certainly be part of invalidating environments. So, guiding tenets to my work, that basically these microaggressions are inevitable, they're going to happen. For people with socially constructed stigmatized identities, that they occur whether we are mindful of them or not, whether we say they're happening. Denial is not going to save us, right? And that being impacted by microaggressions is not the same as being impaled by them. You know, it's one thing to be impacted, it's another thing to be put down, right? So I'm also an EMDR therapist, the eye movement desensitization reprocessing. I think it's been hugely helpful for people who deal with trauma and phobias. And so what we say in EMDR is just notice the fact that you're feeling anxious. Just notice it. You know, as one of my mentors said, it's just a panic attack. You know, you may feel like you're getting ready to die, but it's just a panic attack, right? And you can say that without minimizing the fact that people's hearts are beating fast and they're sweating and they're nauseous and they feel like they're going to fall out and they just know they're going to die, right? So it's just a panic attack. You're safe. Do you trust me? Do you know where you are? We're in the room together. You're going to be okay. And if you need to stop, tell me, and I'll stop. Stop the EMDR. So being impacted by anxiety or microaggressions is not the same thing as being put out by them. And distress is an anticipated response to microaggressions. I say to people, I can understand how you might feel like you want to just kill yourself. We don't condone that option. We don't want that. But I can understand that what you've been through, you don't feel like this is worth living for. Let's validate that. Let's stand in the presence of that. And can we find different ways to look at the situation together? Can we do that, okay? Can you trust me to hold that with you? Because I can hold that with you, all right? So in my research that we've done, we've looked at co-occurring conditions with microaggressions. So this is not causation, because we didn't do that kind of a study, right? But we asked people, we had a large sample, 59 for a qualitative study, and we interviewed highly educated people of color, whether they looked like people of color or not. You don't have to be brown to be a person of color, right? And so this is what we found. This is just the first slide. We found anxiety and panic attacks that co-occurred with microaggressions. PTSD-like symptoms of replaying the event over and over in one's head or having flashbacks of the event, right? Even to the point where people would rehearse going into a faculty meeting or rehearse going into a class because it was an invalidating environment. The sense of, if I say something, I'm going to be belittled, or people are going to think that I'm not smart, or people are going to question my authority or my legitimacy. So fatigue and exhaustion, the sense of just worn out, right? I'm just so tired. Forced compliance, the sense of I got to do it. There's not much else I can do, right? Reduction in the amount of adversity work, where people begin to not necessarily trust that their actions, their beliefs, their efforts were really going to make much of a difference in terms of changing the world, bringing out more social justice, basically making a dent in the disparities. The excessive alcohol use, as well as the reduction, or rather chronic infections. So self-medication through alcohol and other drugs is a way for people to try to feel better. because they feel lousy. So they will turn to alcohol. I have a lot of patients using cannabis, so lots of efforts to feel better. Sadness, anger, resentment, loneliness, and frustration, feelings of second-class citizenship, as well as high blood pressure, right? I say to my students, we have to look at the demographic data and say, what's the narrative? Why do the data look the way they do? Why do Latinos have so much diabetes, and Native Americans, and Black people, and low-income white people? Why is that? It's not just numbers. Let's mine that. Let's suss that out and figure out, why do the data look the way they do? Why are there so much eating disorders among young women? And I'm not talking teenage women. I'm talking about pre-adolescent girls and boys. Why are rates of suicidality increasing among kids in New Hampshire? What is all of that about? What is it about the environment that informs, that impacts the lived experience? Recurring cancers, overweight, obesity, that sometimes there is such bitterness in life that people long for sugar, for sweetness, for something soft and warm and puffy and good, easy. Doesn't fight with me. I don't have to wait for it. I can just get it, right? Feel lousy afterwards, but in the meantime, it scratches that itch. Okay, nosebleeds, diabetes, heart palpitations, thyroid disorders, headaches, migraines, sleep disturbance. So these microaggressions impact the entire body. Most of my patients are physically ill. There's no way you can deal with depression and stress and invalidating environments that say, no, it's not happening that way. Are you sure? Are you sure it happened that way? Aren't you being too sensitive? I don't think that you have really analyzed that one well. That's not my experience. Those are invalidating experiences. That's what invalidating environments are. So the wear and tear on the body, Obasi has done some research on that basically this chronic stress exposure, which is what these microaggressions, discriminatory events are that impact people, right? There's a wear and tear on the body and the mind, compromising the capacity for the body to recover, to basically knit itself back together. So it's a conundrum, though. And we talk about this in my research team. Racial and ethnic minorities, as well as people who are othered in our society, will work within institutions that privilege the perspectives and histories and narratives and optics of capitalism, patriarchy, whiteness, ability, gender conformity, and heteronormativity. So we know that. They're being trained to work in those institutions, right? And yet it's in those institutions that oftentimes it's these microaggressions and invalidating environments are happening, right? So we're saying to the students, get those degrees, stay in school, do well. And yet in these environments can be the source of those microaggressive experiences. So knowing that, we don't ignore that phenomenon, but we do have to prepare, I think, people for it and help them to not just hang on for dear life, but thrive. So I want to look at a little case study. This is Laurel. She's a junior college professor in North Carolina. She was born in Colombia, immigrated to the U.S. as a child with her family. She told her mentor that she thinks that her students are questioning her credibility, right? They ask her if she's sure of her answers, tell her that the previous instructors described the material differently. These are all incidences I created, Laurel, from my microaggressive narratives. So everything that I'm saying here is what was reported to me by the people in my research. They roll their eyes, especially when she starts to talk about issues of diversity and race and privilege. They pass notes. She's noticed that several students call her by her first name, although she's asked them to call her Professor Rojas, right? Laurel suspects that this differential treatment is due to skin color, gender, and ethnicity. And so she shared this hunch with her mentor, a senior white professor. And the professor says, you are approaching this incorrectly. This is not related to what you think. Take it as a compliment. Students know you're young, want to connect with you. Try not to be so sensitive and suspicious. There will come a day when you will long for your youth. right? So Laurel's confidence is dropping. Her anxiety is increasing. She's weary of the classroom. Do you know how hard it is to go into a classroom week after week and you don't want to be there? Or you feel as if this is a sharp, infested kind of tank? I'm not gonna do well? And she contemplates exiting before going up for tenure next year. She does not enjoy going to work anymore. Right? So this is a difficult situation for Laurel. Does anybody know any Laurels? And some of you are Laurel. Absolutely. So, invalidating environments occur when one's discussion of a private experience is not validated. It's not validated, it's not heard. It's like what you're saying is bouncing off of people. You trivialize, one's narrative is trivialized. Conveys to the individual that the one is wrong regarding how they've described their experience or made sense of the experience, and invalidating environments attribute one's experience to socially unacceptable characteristics of their personality. You're suspicious, you know? Take it as a compliment. Don't feel that way. That's what invalidating environments do. The way you're feeling, the way you're thinking, the way you've read this is not right. So what do we want in terms of ally-mentor competencies? Validating people's lived experience. It's possible for that mentor to say, you know, I don't necessarily hear it that way, but I'm interested in what you have to say. Tell me more. I'd like to learn. I'd like to listen to what you have to say. Because sometimes what you hear is not something you understand. Your frame of reference is inconsistent with that. So tell me more. I'd like to learn from you. I'd like to hear what you have to say. That's validating. Community with people who have ethnic racial literacy. Literacy means this awareness that ethnicity and race and skin color are variables in our culture and our society. And to behave as though they don't exist, which is this color blindness, is to distort the reality that these variables do have an impact on people's lives, right? And so that's what is important for Laurel's mentor to be able to hear. Laurel's mentor doesn't have to be a woman of color. Laurel's mentor doesn't even have to be a woman. Laurel's mentor needs to be someone who can listen and understand what it might mean to be a young Latina working at a university when you have these discourses about who's smart, whose histories matter, whose narratives are legitimate, whose knowledge is to be respected, okay? Recognizes bias and privilege on the self, so the extent to which the mentor can say, you know, I've been impacted by my privilege, or I've been impacted by these narratives. And then cultural humility, which is, tell me more, help me to understand. There's some things I don't know. So woke mentors, they stir consciousness. They broach fugitive topics. That's some language from Peggy McIntosh, this whole notion of these fugitive topics that go underground, that sense of you've got to hide it because you can't speak your truth, you can't say it because people will not believe it, or people will shame you, or people will ridicule you, right? So how will leaving before tenure advance your career? Having those questions asked, right? What were you expecting your mentor might understand about your experiences as a woman of color in the academy? What were your hopes, expectations? Where might you go geographically and occupationally to escape gendered racism, right? Because some people are like willing to bail. I'm getting out of here. Okay, sometimes we do need to leave. But do you think that different is always better? Because it's not. Sometimes different is not better. Sometimes it is, but sometimes it's not, right? And what is it in your toolkit to successfully navigate through this invalidating terrain with your mind, body, and soul intact? So Laurel needs to keep her current mentor, I think, because it can be challenging for her to let her go, because this woman is going to be voting on her tenure someday, right? And work with another mentor. So it can be a both and, a dialectic. You can learn from people you do not like. This is something that I'm trying to teach my daughters, right? You can learn from people you don't like, you know, because just because the violin teacher doesn't, you know, make jokes that you think are funny. You can learn from that person because they have some brilliant skills to teach you, right? I think sometimes women get caught up into this because we want the relationships to feel cozy and nice. And that's great. You need to have those cozy and nice relationships in your life. But if you think that you have to like everybody that you learn from, you're going to have a very small group of people that you can learn from. And you miss the opportunity to learn from people who have really something wonderful, magical to offer you. And you can work with people you don't trust. Doesn't mean that you can't benefit from that environment, but you have to know that you don't trust them. And so what does that mean? They're not part of your inner circle. Maybe there's details about your life you don't share. And you don't have to let people know you don't like them and you don't trust them, right? I mean, because otherwise that can create quite a dynamic, can't it? You know, I don't like you, I don't trust you, I'm gonna let you know it. Yeah, so it's important to know that can really not work well for you. Does that mean that you're kind of lying all the time? No, it means that you realize that there's a socio-political nature of thriving in environments that can feel very microaggressive and invalidating. But you do have to have those spaces and places where you can go, where people are happy to see you, and you can speak your truth, and you can be honest, and you don't have to deal with the energy involved with thinking about what you said, try not to say something else because you know it'll get you in trouble. It'll be disastrous because people can come at you. There'll be some reprisal, retaliation, can threaten you. So I like this song that Kenny Rogers sings. You know, I used to sing it to my students, and they'd sing along with me. And now, because I'm getting older and they're getting younger, I start singing, "You gotta know when to hold 'em." And they look at me like, "Oh my God, what is?" She's a little, something's going on with her. And then I tell them, "Sing with me." And then they're like, we don't know that song. You don't know Kenny Rogers? But I love the lyrics here in terms of it's very astute in terms of you got to know what to do. You got to know when you need to speak. You got to know when you need to exit. You need to run the heck out of there. You need to know when you don't disclose what you've got. You need to know this is untenable. I can't stay here anymore. I've got to go. This isn't working anymore. And I've exhausted all of my resources. I have done everything I know. I have thrown all of my wisdom at this problem, and it is not getting better, and I'm getting sicker. I've got to go. But it's important to be able to detect that from your environment, to be able to know that. Okay. Suboptimal resistance. My colleague, dear family friend, Janie Ward, and I developed this back in 1990 because Carol Gilligan had gone to Janie and said, "You know, I want you to write a piece on what is it that Black girls and women need to do in order to resist. You know, we've been talking about resistance for women. What does it look like for Black girls and women?" So Janie and I developed this theory on resistance, and over time, it's been a while, I've developed a tool to measure the construct of resistance, but we talk about suboptimal resistance. We were really inspired by Linda James Meyer's work. But suboptimal resistance for Laurel would look like premature exit, leaving before maybe she has enough information. Collect the data. Sometimes it's hard to collect the data because you're so uncomfortable. Persistent and consuming anger and hopelessness. That's the stuff of depression. Self-blame, isolation. Isolation is connected with shame and secrecy and silence. You don't tell anybody because you're really ashamed of what's happened to you. You can't believe that you're in this situation, so you don't talk about it. And yet don't harbor that. Let other people in. Maintaining toxic relationships, being shame-based, numbing eating and drinking, denial, untreated mental illness, right? And then optimal resistance is this belief in self far greater than anyone's disbelief. Socio-political awareness of discrimination, you know, knowledge of how people who look just like you and who don't have prevailed. You need to know your history. Other people have walked this path. Intentional self-care, respect for what you and others have done to coexist within a suboptimal system, because that's what it is, a suboptimal system. An embrace of peers and allies to thrive. We also found that this wasn't part of our original model, that there was this phenomenon called armored resistance. That there's this hypervigilance, there's this scanning of the environment for incoming bias. So that people are ready, they're not going to be ambushed, and they're going to detect the microaggressions before they come to get them, if you will. But we found that this contributes to a sense of scrutiny, constant hypervigilance, scrutiny of the environment, which we think isn't necessarily sustainable, even though it might give a person a sense of being in control and being prepared. So what are tools and strategies? Show compassion for the self. Depression is a brain disease. It's a medical condition. The research has shown that people can get better. So certainly therapy, lots of different modalities, exercise, nutrition, meditation, prayer, gratitude, medication. Some people find that ECT helps. Deep brain stimulation, because some people have tried every SSRI, benzo, and it's not working. Deep brain stimulation can be helpful for people. The use of magnets, transmagnetic imaging or stimulation can make a difference. But again, this gets into money often and insurance, and not everybody has access to that, right? Ask for help. Some of us grew up in cultures where if you asked for help, it was seen as weakness. That if you asked for help, it was kind of a taint on the family because the sense of collectivism, so it was shaming for the family. So asking for help or letting people know that you needed help was that somebody had failed or your parents weren't good parents. We need to basically push back against those beliefs, we call them distortions, because asking for help is human. And there are people who are well poised to help you. Give help, ask for what you want and need. Make a list of the people who you feel genuinely love and care about you. And that may be very different from the people who are telling you that they love and care about you, right? How do you feel? How do you feel? Do you feel that love? Do you feel that care? Get to those relational spaces. It's like a destination. You've got to get to those people and spaces who you know I'm safe, I can speak my truth. It may not be a long list, but there has to be people on that list. Have to be some people. Choose your battles. You cannot go to the mat for everything. And you have to give yourself permission to say, I just can't take this on right now. Triage, if you have to. Laugh, play, create. I tell my patients, color. Go to the store, get a coloring book and some pencils. There's something about the movement of that pencil across the paper that is calming to the brain. Color. Some people, that's why people knit, right? That motion, that rhythm, it can make a difference. Same thing with the running, the pounding on the pavement, or the walking, right? Cultivate joy and dialogue. There's some real power in the beauty of talk. We live in a world, I was talking to a colleague of mine, he says, people just don't talk to each other anymore. He says, we send emails, we think, I got it done. But what would happen if we just walked down the hall? How to talk with people. You call the credit card company, and you have to go through all this minutia. Press 1, and it's like, you people really don't want to talk to me. I want to talk to you. So, so it's unnerving. So is it reasonable not to feel mad, sad about chronic wrongdoing? It's a normal reaction. Exercise, move your body, nourish your body with good eats, sounds, visuals. Be still, meditate, rest, sleep, create boundaries. I call it the yellow tape. You have to create boundaries in terms of this is, not that you're rigid, but no, this is not a space where you have access to. So it's important to be able to say yes when you want to. Again, this is a very gendered issue. Oftentimes, but men are also impacted by this, as well as transgender people. No, it's not synonymous with a lack of care for others. Just because I say no doesn't mean I don't care about you. And it's hard to sometimes say no, so we'll say yes, but then we'll feel resentful, and that doesn't help because that leads to anxiety and depression and lots of anger. Not now. Some of us have been saddled with amazing responsibility as children. So to say not now feels dangerous or reckless. And sometimes the answer is, not now, I don't know. Later maybe, but not now, right? And then not dwelling on microaggressions is different from being oblivious to them. Sometimes we have to decide that we're not going to dwell. Reducing contact in high conflict situations can be the best option. And sometimes this giving of ground, letting it go, is also sometimes the only thing that's available for us. There's power in naming, of being woke to the weight of exclusion. and the shame and the sadness and the depression that oftentimes accompanies that, and to be able to call it by its name. That's what we call optimal resistance. In the naming, we shrink the impact of these invalidating environments. We become aware of our cognitions, and we gain knowledge and skills. We acquire these skills that encourage momentum. We engage in dialogue, and we avow the power and the grace of community, which allows us to live our best lives and to move those barriers out of the way, which prevent us from living our best lives. Thank you very much.
I just wanted to start off sort of bouncing off something that Tracy mentioned about not letting the people in your life who you don't like or don't trust know it. I have found that letting them know it has been really good for my mental health. Not saying everyone should do that. I'm just saying it's been good for me. The other thing is, I'm always encouraged when people talk about microaggressions, but I hate the term. A microaggression is my dog slapping the side of the bed when he's ready to go out. If you're talking about things that cause fatigue and depression and sadness and resentment, now that's more than a microaggression. I know it's not your term, but I'm saying, and I think when you talk about the power of naming, there's something in the power of that name, because it minimizes the impact on the person who's targeted.
May I respond to that?
Oh, absolutely.
Yeah, I hear what you're saying, Renee. Can you hear me? Okay. So, but it's, Dr. Pierce talked about it being these 1,000 little cuts, right? And the reason why I think that the term microaggressions is not intended to minimize, put the word micro in there, is because oftentimes the people who are microaggressing, or the environments that are microaggressive, are so subtle and unintentional, right? So it's not that there's this sense of malice or even consciousness on the part of the person. I think so many of these practices are steeped within our culture, these dominant values within the culture of capitalism, of patriarchy, of sexism, of colorism, and the list goes on. And so I hear what you're saying, that the microaggressions can feel like you're not speaking and you're not naming the potency of this hurt on my life, the bigness of this problem in my life. I get that. I think that because they're so cumulative and they're chronic and they're constant, which can certainly feel like they're writ large in our lives, it doesn't take away from the fact that, again, so many of those incidences are par for the course with regards to our culture and some of these dominant values. And that's why I have a constant gaze on these dominant values and being able to say, wait a minute, it feels very, very normative, these microaggressions. People aren't even aware that they're doing that. They need to become more aware. And the person who's being impacted by them needs to not feel that I'm being too sensitive, as much as to be able to put it within a larger environmental context, as part of a larger cultural context. But I hear you. It was a term that Dr. Pierce developed in the 70s, and there is a term of macroaggressions that certainly can speak to not just an individual, but a group, like not just an individual who identifies as queer, but the LGBT community, or to women. So I don't know if macroaggressions would help people to feel as if their experiences are not being minimized, but it doesn't change the fact that these events are so constant, and people who are oftentimes engaging in them, or the environments themselves, are not aware. And I think that that's the 1,000 little cuts that feel so toxic.
Now, we're having a conversation. We want everyone to participate, so we'll have a Q&A session near the end. But if you have questions as we're talking, please feel free to ask them. James Baldwin said, "In America, I was only free in battle, never free to rest. And he who finds no way to rest cannot long survive the battle." There's a psychological tax on those who are marginalized by race or ethnicity in this country. We rarely feel that we can rest because we're always on high alert. we feel like we're always under siege under these sort of relentless tentacles of racism, Islamophobia, sexism, homophobia, for some people, all of them. It's a form of what I've heard toxic stress. And generally speaking, what are the long-term mental health effects in communities of color of living this way day to day?
Sure. So I think Tracy just did a phenomenal job naming sort of this cumulative effect over time. And I think what I've seen, I've worked with, for 20 years, immigrant and refugee populations and also communities of color. And what I've seen very oftentimes is a mistrust of the system that could potentially be helpful. With all the power structures that be, it's very difficult sometimes to find the correct access. So the accessing of adequate support is a true barrier. Also, what we know from just a biopsychosocial lens, so a lens of understanding, again, genetic factors, intergenerational cycles of poverty, intergenerational cycles of trauma, what those do over time can be very, very destructive. And what we see is a lot of times, again, a mistrust of the system, a difficulty accessing support, and then those cycles repeating from generation to generation. Tracy, do you want to also share?
I think it certainly impacts the length of life. The mortality rates are higher among people of color and lower income people. I think it impacts our weight. I also think it leads to a sense of PTSD. I believe that microaggressions and discrimination are trauma because of the chronicity of it. And there's this sense of it's just unrelenting, and it's not about anything that I've done, right? And so that, I think, is the sense of just being under constant siege. So the trauma that people oftentimes feel they may not even be aware that their response is steeped in trauma, the nightmares, or the avoidance sometimes of situations that resemble where the microaggressive or discriminating events take place, which can then wreak havoc in people's lives in terms of, well, you avoid certain people, you may need those people in your life, or you avoid classrooms or professors or work, certain routes or interactions, because the trauma is kind of like the lead element in a person's life. So at the same time, I think we've seen activists and people coming together, the community conversations that takes place in Cambridge for people on Sundays. And we see examples of people basically saying, wait, we can make a difference, and we can help people to find better tools to live their lives. But let's not be naive to how, on the human being, this constant exposure to trauma is devastating. And it is the stuff of, I think, oftentimes family violence, of marital and interpersonal disruption, certainly of the loneliness, the isolation, substance issues, where people are simply trying to not hurt so much. But I think Kristen's point is very powerful, that there oftentimes is this mistrust of the mental health system, and for good reason, that the way in which people have been abused by the system that was supposed to help them. And yet there is an oasis, if you will, in the desert. There are places that you can go and get help, and mentors and helpers out there that can make a difference in people's lives.
And I think just to add, with the global mental health crisis as well, when we look here in the US and across the globe, what we're also seeing is a critical shortage of mental health workers. Also within that, as a sublayer, we're also seeing a lack of representation. So you're not going to necessarily go to a therapist that looks like you or has the cultural competency and sensitivity and responsiveness. So there's that level. But what we're looking at is a critical shortage. Many of you may have had this experience where you're waiting 6 months to 12 months to get an appointment. How many of us have had that experience? And I think that's why, again, they say that when research comes out, it can take about 10 years for it to really come to public awareness and consciousness. And I think that's why what the research is showing, not only is psychoeducation important, so the naming of phenomena, the dialogue that we can have to understand how to look at things through a more holistic lens, through a biopsychosocial lens, through a strengths-based lens, not a deficit lens, to understand that, and then to be able to then employ strategies in our own lives and in our own communities that help, again, build on strengths, look for assets and resources. And, you know, right to your point, when we look at like the work, for example, of the Robert Wood Johnson Foundation, many times when we're thinking about socioeconomic status baked into this and issues of class and access, it's where your zip code is. They call this social determinants of health. Many of you have heard of this, that determines your health outcomes. So again, access to actually getting therapy can be very impeded. So I think that's what we know, again, is that the psychoeducation is helpful, but as I mentioned before, supervised skill practice. So again, Tracy really so eloquent in sort of where these spaces where we can show up and feel safe and feel loved and valued and we can be our true selves, and how do we continue to nurture that. I know we're going to want to talk about this too on a public level. When people make disclosures publicly who are people of maybe fame or stature, how that can help us all come out of the shadows. When we can recognize again, wow, if this person, again, who has all the money or status, or they probably have personal masseuses, or, right, we sort of have these ideas about so-called success and how that might protect us or not. But ultimately, I think we have to continue to look at it, again, as human condition, not mental health condition. How do we, again, employ strategies? And if we're in a position of power and privilege, how do we then extend that? How do we help liberate one another in this very, very difficult worldwide crisis where, again, we're seeing many barriers to care, but simultaneously, we're seeing more people willing to disclose, right? So it's this weird paradox, right? There's more disclosure. I know from my younger students, I teach a stress and resilience course. That's one of my signature courses. And they'll come in and say, I have PTSD, I have an anxiety disorder, I see my therapist. We didn't see that in generations past, right? We're seeing a lot of shifting happen. So I also want this to be, encouragement. We have a lot we can build off of, but I think it takes that courage, and it takes us to just look at the science of it.
It's gotten better, but that stigma is still very much there.
That's right. That's right.
So, 50, 60 years ago, people wouldn't say that they had cancer. It was a shameful thing, or they would whisper, oh, she has cancer. And now people talk about it readily. People will talk about prostate cancer or breast cancer, whatever type of cancer it is. There's no shame in it in the same kind of way.
That's right.
But that exists in mental health. No one's talking about saying, oh, I took some time off, I was feeling depressed, or I'm getting therapy, or I'm getting this. You talked a little bit about famous people, sort of talking about the sort of lifting the stigma. About 3 years ago, a rapper named Kid Cudi released a statement on his Facebook page essentially saying that he was going into rehab for depression and suicidal urges. And he posted the message that said, I am not at peace, it's time I fix me. Now, a lot of people praised him for that, for being so open about it. But Drake, another rapper, put out a song called Two Birds, One Stone, in which he mocked Kid Cudi for his mental health issues, including the line, "Is you crazy?" That sparked a lot of conversations in the hip-hop community about, a diss track that went too far, but it also highlighted mental illness viewed as a sign of weakness. And in hip-hop, if you're weak, you're soft, and if you're soft, figuratively, you're dead. So let's talk about the stigmas around mental health that exist within communities of color, the source of those, and the ways that racism plays into that.
I think, do you want to start?
Well, I have a lot of thoughts. My first thought is certainly internalized racism. The extent to which, people of color swallow whole introject, if you will, these dominant messages about how you're supposed to pull yourself up by your own bootstraps, and how you're supposed to hitch your wagon to a star and be your individual self and make things happen. And so there needs to, I think, be this naming of these ideas or thoughts or practices where you say, I disagree. I don't buy that. That doesn't work for me. I know that many years ago I used to do a support group for women who were survivors of incest. So many of those women had been told by ministers, well, just have faith. Just believe in God, and God will take care of that. And my thing was to them both, believe in God and come every Saturday for this group and talk about your rage and your anger and your sadness and your depression. And so it's a both and. Because this notion of if you are depressed, then you've failed God, or you haven't allowed God to do God's work in your life. And yet I think it's a short-sighted way of not really looking at the larger context, the larger environment. What about the aggressor and the perpetrator, and the system that doesn't allow us to name that or to insist that this is a place where we can talk about that, and we're not going to judge you, and we're going to help you and throw everything we can at your recovery, which is what it is. So I think that sometimes communities are not, they don't have enough tools in their toolkits, if you will, to see how we don't have to perpetuate some of these damning discourses or damning practices that don't help people to get better, but keep them stuck and sick.
These messages of strength. You have to be strong for your community. You can't be weak. You have to step up. You have to do these things. Nearly 20 years ago, my father died suddenly, and I was a mess. And I went to a good friend and I said, I'm kind of thinking maybe I should see someone. And what she said was, Rosa Parks didn't need therapy. I don't see why you need therapy. Now, I don't know that Rosa Parks didn't need therapy. I don't know that Rosa Parks didn't get
Rosa
therapy.
Parks not need therapy?
But the idea was, if she went through what she could endure, then you just need to buck up and get yourself together. And I didn't go, and I should have gone. I needed to. But it was that message that, you're being weak. This is not what Black people do. Yeah. You don't go out and put your business in the street. You hold it together and you handle it. You pray it away. You do whatever you do, but you don't go and pay someone $95 an hour and tell them your problems.
Right.
That's a huge stigma for, I think, a lot of people in communities of color. It's not just in Black communities. I've heard of it in Muslim communities. I've heard about it in Latinx communities.
I see a lot with my Asian students at Northeastern as well. We have a lot of these discussions around culture and global mental health and safety of disclosure, and again, how race and ethnicity, it's like, if you kind of come back to connect the dots to what you're saying around Claude Steele's work, for example, we were talking about this ahead of the conversation. How many of you heard of stereotype threat? So it's this whole notion of fear, vulnerability, the stereotype. If you were going to then become the thing that you're most afraid of, that your group has been projected onto. So it's like if if you're seen as being weak and then you admit the weakness, it's like you're almost validating that within yourself, and it's a very vulnerable thing. I think the thing, you're talking about 20 years ago, again, we have seen a tremendous amount of shifts, I think, in terms of reframing even vulnerability. I think Renee Brown has helped kind of create new language around that in many ways, to recognize that asking for help is actually brave. It's a sign of strength. But again, it's complicated. And I think for myself as a white woman too, I think I recognize that there has to be caution, which we understand this in terms of, again, who is it safe to disclose to? And do you have a therapist that's going to be culturally competent and responsive, and that the supports are there? Is it truly safe? So I think we have to be cautious about that. Having said that, I think, again, we're very fortunate with the advances we have in brain science and with the amount of information we now have access to understand, again, psychotherapy isn't just deconstructing the skeletons of the past. We actually have evidence-based treatment that can help a person build off of their strengths, resources, and assets, and to have a strategic plan. One stat came out that was very compelling for me. It said that years ago, people said they had 2.87 confidants. And then it went down to 2.76, and now it's at 0 for people who are in college. And I think, again, with that whole loneliness thread, I think we think we're the only ones. Now we understand you go through the trauma of losing your father and the grief, right? We understand the intervention is a tool to help a person. Just like if you had a broken leg, you would seek medical care for that leg. You would seek care for grief. So I think it really does happen on a grassroots level where people talk, like you just saying that, I would imagine is very helpful because you're a powerful woman. People look up to you, they understand your legacy, and that, I think, creates safety in this room.
Years later, I told that friend off. I just released him.
I'm glad you
do
did.
it.
Yeah.
Told her how not helpful she
Yeah.
was.
She was so unhelpful. And I would just say, Renee, it's not too late. If you decided that, you wanted to get therapy for that issue, or it's never too late to basically go back. But you're right, that friend got it wrong.
Yeah, it was I needed help, you're an idiot. That was essentially the conversation.
But it's also that whole thing, I think it also could have raised that person's vulnerability themselves because they're looking up to you, they're like, you're strong, so if you need it, what does that mean for me, right?
It's a very good point. She probably needs it too. Right?
When you were talking about the microaggressions, I kept thinking about the idea of social accommodation. And when we spoke last week, you mentioned, one of you, I can't remember which, mentioned the book Whistling Vivaldi.
Yeah.
I did. Yeah.
Which is by Claude Steele. And what the title refers to is Brent Staples, who's now a Pulitzer Prize winning columnist for the New York Times, but years ago he was a grad student in Chicago in the Hyde Park area, and he would walk around at night and he would notice that white people were really uncomfortable around him. They would, move away from him or clutch each other and that sort of thing. So he started to feel very uncomfortable, and what he began to do out of nervousness was whistle. And he found himself whistling Beatles songs and Vivaldi's Four Seasons. And he noticed that the white people around him reacted differently because he was whistling this piece of classical music. So that made him less threatening. But, and look, if need be, in a pinch, I suppose I could whistle part of the winter portion, But I don't want to have to do that. But what does that kind of social accommodation do to you mentally? That you always have to go in a situation thinking, okay, how do I make this room full of people comfortable with me? And you're thinking more about making them comfortable and not your own comfort. What effect does that have?
Fatigue. I think Tracy spoke really well to that earlier. The fatigue, the hypervigilance, again, when it goes on that side of you're always protective. I think, again, when we look, I know in my study I was looking a lot, again, at resilience and identity, our sense of self, a sense of feeling safe to show up and be our true selves, to tell the sides of our stories, to feel safe. That psychological safety is so vital in life. And when we lack that kind of safety, again, it's not only exhausting and anxiety-provoking, but it's very traumatic as well. I think that, again, part of our unlearning, when we look at our polarized socio-political landscape, we've inherited a fight, right? We've inherited a very difficult history. And again, kind of coming back to Rorschach and the in and out group and the dominant group, who gets to define what's normal, who's acceptable, who's okay, right? We have a lot to overcome to continue, again, to work together, to create more safety, again, to stop with the unconscious biases, the outward biases, the macroaggressions. We have a lot to overcome, but it certainly can penetrate. And that's why, again, we need to continue to forge communities where we can get the right help, and we can, again, look at what we're being sold. We're being sold these ridiculous messages. And again, if we think about from a mental health perspective, I'm crazy. You brought this up about what Drake said in the song, right? You're crazy. You're not good enough. You're stupid. You're an imposter. You're an embarrassment, right? Think of all that language from a generational and cultural standpoint that has permeated and penetrated for far too long. And it's just, if we actually use a critical thinking lens, we realize how ridiculous it is. It's just foolishness.
I would also say that part of intentionality is to know what's going on, right? You give yourself permission to enter these environments knowing, I guess I'm going to sing Vivaldi for this period of time. I'm going to do what I need to do. And I need to also know that I can get to places of safety, places of reward, places where I don't have to do that. But, and is it worth it for me to keep going into these spaces having to sing Vivaldi, right? And so I think that that's when people begin to say, do I give myself permission to know what's going on, to name what's going on, replace it with something else? That's that socio-political knowledge. But also to show compassion for yourself and say, this is exhausting, as Kristen was saying. I don't want to have to do this all the time. I'm tired. And maybe I'm not going to do it today. Or delegate, but sometimes you can't even do that. You know, you just show up. You show up brown. You show up female. And so I think that sometimes I find that my friends will sometimes call me, and if they have a story to share that is just ridiculous, they'll say, "You will not believe what happened." So when I hear that, "You will not believe what happens," I know I need to get my tea and sit down and wait, because usually she has something to tell me. And I think that knowing that when you've been through one of those, yet again, ridiculous situations that don't make sense, but you know you can call somebody and they're there to listen, to validate, and not scrutinize and say, "Are you sure? Did you get that right?" You know, but that person's going to listen and say, "I hear what you're saying. I get that." But to also respect that it is not a happy. It's not a happy situation. It's not a fair situation, and yet it is a situation that it doesn't end us. You go through it. You find a way to go through it, and you find a way to rest afterwards. I think that's.
I'm trying to be mindful of time so we have some time for questions, but I wanted to get to something really quick that we mentioned. Oh, someone had a question? I'm sorry. Is there a question?
I have a question. So thank you very much. This is really a wonderful talk. I'm curious about the allyship piece, practicing allyship. And the late James Cone said, "To stand with the oppressed is to be treated like the oppressed." And I'm wondering, as you were talking, I was wondering how in your own academic career or your own life, has that played out, or has that played out? That sense that if somebody is not Black and yet standing with the oppressed, that somehow is going to affect them and their career. I mean, I guess there's a question about whether or not you believe it, but if you do believe it, have you noticed anything about that? Does that
Thank
make
you
sense?
for the question. It does. So I'm thinking also just kind of when you were speaking to, I was thinking about the intersections of class, and also upward mobility, and thinking a lot about, for myself, coming from a blue-collar family. I'm also not straight. I don't identify as straight. So I just wanted to mention that. But I think a lot about intersectionality and just the understanding of marginalization and oppression from different social identity vantage points. But I think that whenever we have any kind of form of privilege, we must use that to forge social change. And do I feel like that has come with negative consequences? No, because it's what has to be done. And I think, again, we have to take a strong stand and speak truth to power. The hierarchies, the patriarchies are so damaging on people's lives and mental health. So any kind of risk or consequence would pale in comparison to the importance of doing so. I think, again, with mental health, I would say that, again, there's still some people that probably get very uncomfortable around me, and that's okay, because awkwardness and discomfort are all part of the unlearning process. Is that helpful? Is that answer?
I would also say that I think about a quote from James Baldwin, and he said, "If I say that I love you, I have to bring to your attention those things that you can't see," right? And I think that's the essence of being a good ally, that you link arms with people and you say, "Let's go. Buckle your seats. It's going to be a bumpy ride, okay?" But you will not have to be in that bumpy ride by yourself. But at least let people know this is what you might anticipate. And some things I won't completely understand because I may not have that frame of a reference, but I have a larger frame of reference, I think a more essential frame of reference, as a person who certainly has been targeted by microaggressions, but also as a person who wants to journey this journey with you. So whether my student is a person of color or whether they're heterosexual, it doesn't matter. They're my student. We are we. And so so there's a relationship. And I think our students are hungry for relationships that mean something, where they feel that they matter. Technology, I think, in some ways has elevated our world, but in some ways it has separated us from one another, I think in some very dangerous ways. And so I think it inspires a sense of loneliness and disconnect, and students having sometimes a difficult time with being able to communicate without the screen, kind of being in the way. So I think it's important to sometimes just look people in the eye and say, look, I'm here. You can be in touch with me. You could text, but you could also just pick up the phone and call. I mean, I'm a baby boomer, so when I was growing up, I don't know why we would get quiet in the house when we got a long distance call, but when there was a long distance call, the house would get really quiet. So, my relationship with digital literacy is not the same for, my students, but it doesn't change the fact that people still, I think, want human contact and connection. And I think that's the beauty of being a really present ally. And also that cultural humility. There are things I don't quite understand. I may have to tell you, you may have to tell me because I don't get it. But I'm here and I'll listen, and I'm teachable, right? Being teachable, I think, is one of the best skills you can ever have. It's a great question. Thank you.
I think the last question I want to throw out is how people are coping with the news cycle. I have a good friend who's a therapist, and he said whereas his patients would be in talking about their spouses or their parents or their bosses, now all they talk about is what they're hearing on the news or reading on social media. And it's all these same things: fatigue, sadness, depression, the erosion of rights, the uncertainty of where this country is going. What's your advice to people to cope right in this really interesting moment with what's happening with the news?
I think it's vital that we recognize how much money is being made off of fear. When we look at the last election cycle, it was a gusher. Billions of dollars were made by the news outlets. We're getting, yeah. What we see coming through our feeds, right? We have to employ a critical thinking lens to recognize that there's hooks on our brain, right, that cause us to watch and participate. I think we have to look for substantive sources. We have to set boundaries. Again, just like the good old-fashioned time in nature to breathe, put our phones down, because again, there's so much hype to it, and there's so much that's superficial and not helpful. When we look at worldwide data, we have many advances, whether we're talking about improvements in mental health, racial disparities, all the disparities. We're seeing a lot of improvement, and we're seeing a lot of models that work well. We're seeing a lot of great examples of empathy, but we don't see those stories coming out very often, right? So it's going back to the overturning of the deficit paradigm and what we pay attention to and how we can grow that.
Yeah, I would say I have patients who the first issue that they want to talk about is something that they've heard in the news and how distressing that is. And so I basically want to know if they're feeling triggered by something they heard in the news, because it can arouse a sense of uncertainty, or I can't trust, or I don't know what's going to go on, or how my children are impacted. So I want to talk about that from a clinical lens. But I want them to know, I've got some of the same concerns and questions too, right? And still keeping my, my clinician hat on. So I think that these are times that are troubling. These troubling times for clinician and patient alike, right? And so then I want to know, who can you talk to about that when you're not here? Because the fear or the anxiety is not only within you. There are other people who feel that way. So I want to get a sense, do you have other people with whom you can share the concerns? Does it remind you of anything else in your life? What are you doing to deal with that? So people talk about, well, I don't watch news after 10 o'clock, or I record the news so I can, fast forward through the icky stuff or the stuff that's disturbing, or I don't watch the news anymore. And so I think that some people will try to find some strategies to put in place so that they can kind of safeguard themselves. But then some people have this really intense exposure to it, and they keep playing it over and over and over again. And sometimes that can, on one hand, be helpful for some people, but for some people it isn't, And so I try to put something in place to help people get a sense of what is it that you can do to unplug, but it's hard for some people to unplug because they're afraid of unplugging because they'll miss something, right? So, but yeah, I think what I do is name the fact that, yeah, these are difficult times, and I can understand how you would be feeling the way that you do, and you're not alone. Other people feel the same way. Then I may do some psychoeducation, just encourage them, educate them with, what I've learned that some people can sometimes do, and just remind them, because some people do feel triggered. and re-traumatized by something else that's going on in their lives, by seeing something on the news or hearing about another group that's not them, but reminds them of the fact that we are not safe here. So I just basically try to listen and validate, and then get a sense of what is it that you can do with what you know and with what you feel, but to respect the fact that they do feel the way that they do.
So it's okay to turn off the news and pick up a newspaper instead. Question?
I just want to say thank you for that question. And we're talking about mental health and ethnicity today, but I just have to say that I think keeping up with the news is very important, and that we should support the news sources in this day and age. That's all.
I agree.
This is a wonderful talk. Thank you so much. A lot of what you're talking about is what I say is the right to fail. And what I mean by that is 30 years ago, I was the first female technician at the phone company out in Western Mass. What a joy that was. But I found that when I made a mistake, it was because I was unqualified to be there. And they had to, fill a hiring quota or something like that. But when my coworkers, male coworkers, made mistakes, it was because they were human. And I find that, here it is 30 years later, and I'm still having that conversation in my head of, I can't mess this up because I'm representing half the population of the world. Can you talk to or address some of the ways that because I know I'm not the only person who feels this way. Can you talk about some ways that we can address that and help us get beyond that point and not add that stress to ourselves? And thank you.
Well, it's a great question. Thank you so much. I guess I find myself thinking of the both and. It's sort of like the two-handed approach. So on one hand, you are being held to a standard that the men aren't. And it's an unfair standard. And it puts an awful lot of stress on you. And the stress can be the stuff of intense anxiety and panic and fear and anger and resentment, right? Yeah, and sadness and confusion. Yeah, that's right. So, and it is a long list of big emotions, right? So that's the one hand, right? But the other hand is the desire to solve and to fix and to make changes and to get it right and to do it well and to shine, right? And so, because you might like what you do or know that you're good at it. And at the same time, you're aware that these people don't think I have the same intellectual mettle that the men have. And they are discriminating against me because of an immutable characteristic. I'm female. I have nothing to do with that, right? And that is the stuff of discrimination, inequity, and unfairness. And that is chronic, and it's old, and it's systemic, and you didn't create that. So if you basically unpack it and shrink it and say, I didn't create the enormity of this discrimination, and yet I'm being put in the middle of it in some ways because there are all these eyes on me. So I know that there are eyes on me. I get that. I know that they don't expect me to be as good and smart as the men, and that there's a larger bar, a higher bar, if you will, for me. What can I do given the risk? How can I manage the risk? Well, one way to manage the risk is to know a good lawyer, someone on whom you can call in the event that, unfortunately, litigation is part of your life and your future. But also I say to people, what about that yellow tape? What is it about the environment that I can control, that is within my wheelhouse? Because I cannot be all to everybody. And where did I learn that I was ultimately responsible for half of the world's population? Is that realistic for me? so that's the unpacking of it. We want to shrink that and basically look at it, gaze at it. It's that oppositional gaze, that we basically want to say, is that fair for me to put that big burden on myself? Is that manageable? Can I even do that? But can I be the best technician possible? Can I shine in this job? What skills do I need? What resources do I need that I don't have, that I can get? Who can I ask for help? Are there any people in this organization who can perhaps help me to solve the problem or run faster or build a better boat? So I think it's good to have a sense of that, but also to really question where this unrealistic set of expectations came from that in some ways was put on your plate. And you can basically say, no, thank you. I'll do this part of it. And then this is the other part that you can't even fix, right? So I think it's important just to critique that. And you may need sometimes help to be able to do that. And I wouldn't suggest you try to figure that one out on your own. It's a great question. But I also believe it's important for people to have a board of directors in their personal life. That was a term that I got from someone in terms of who are the people in your life who can say, well, you might want to do this, or you might want to do that, or I wouldn't do that at all, and just these people who you trust that can share information with you that can make all the difference in the world in how you negotiate your life and navigate through.
I think we need to wrap there because we have some closing comments. But thank you so much for being part of this today. Thank you.
Thank you.
On now? Yes. All right. So I'm Chris Ciotti, for those of you who don't know me, Associate Dean for FAS Human Resources. And I'd first like to just thank everybody in this room for making time to come today. As Renee said earlier, we recognize that the demands on your time and you have many places to be, so we're grateful that you're here today. These conversations are so meaningful to us. It's part of the work that we're doing in FAS and FAS HR to help to create a diverse and inclusive community. So thanks again to Renee, Kristen, Tracy for today's thoughtful conversation on such an important topic for us. The more we can understand mental health with the rest of the world, especially its intersections with ethnicity and social issues, the more we can work towards the environment and the community that we really want at FAS. As always, we're grateful to Claudine Gay and Leslie Kerwin for allowing us to stand up today and to bring this program to you. And a special thanks to Andrea Kelton-Harris. Andrea, where are you? Yes, there you are. Thank you. These creative insights led us today in this new direction of a town hall format. Did you like it? What do you think? Did it work? All right, good, because we're planning to continue it the rest of the year. And also the focus on individual diversity. So as always, Andrea, thank you for leading us in the direction that is so helpful for us to be in. A big thanks also goes to Jessica Bound, Dominique Bocanegra, right next to Andrea, right there. Thank you very much, folks. It always takes a village. They work with Andrea for several months to bring us today's program. So we look forward to being with you again in February and in May. Mark your calendars. Hopefully you can come for our next 2 town hall conversations. And last but not least, Andrea would be very, very mad with me if I didn't talk about this. Our Rally Challenge continues this year. So if you register for each dialogue, if you attend, if you listen, and you learn during the year, you are going to be entered into a drawing for a very fabulous prize. Previous winners have received an iPad, a smartwatch, and headphones. So stay tuned and be one of the rally people who can be available for the prize. Have a great afternoon. Thanks for spending your Monday morning, and go in peace. Thank you.